Asia's hospitals are being squeezed by staff shortages and rising costs, threatening access and affordability. We are joined by Dr. Beaver Tameses of Asian Hospital and Medical Center to talk about what's breaking first and what fixes are realistic. Dr. Beaver, welcome to the program. How are staff shortages reshaping hospital operations and patient wait times?
First and foremost, we have to understand which priority areas we need to really spend time and effort on. Nursing, I think, is probably the most important staff that we really need to coddle or take care of by enhancing their training, giving them career paths to really look forward to. We can potentially retain more nurses and actually see their career growth in terms of their abilities, their specialties, so that they give us 3-4 years worth of service and then deliver fantastic service to our patients before they go on to greener pastures. So we have to look at it as a continuum of their career, their life, so that way they can continue to grow.
Can AI help with this? Can AI and automation actually reduce workload at the bedside?
Yes, it can actually, if you choose it smartly. One easy way to do it is to use like barcodes. When you actually use barcoding to be able to identify the patient, the medication that they require, and then dispense the medication so that you can now properly document that the patient received the right medication at the right time. That reduces the amount of documentation and scut work that the nurse have to do and improves their lives quite tremendously on the floor. The other way, of course, is to use chatbots so that you can now actually book appointments by either chat or later on in the future, online calls, so that patients can now fix their appointments for their laboratories that they may require specialty tests such as nuclear imaging, such as CT scans or 2D echocardiograms. These things can actually be done using AI technology and reduce the amount of workload that the staff actually have to deal with.
But these AI chatbots and the other tech that you've mentioned, these come with added costs, right? So how do you keep high quality care while protecting affordability?
Actually, we have to think of it as an investment in technology so that we can actually free up more time on the part of the nurses to spend time with the actual patients rather than doing more paperwork, documentation, etc. By using AI tools, by using tools of automation, you can actually free up time. So that small investment, say in the barcoding, for example, when you actually do the medication barcoding, you actually free up the nurse from having to actually go through every single chart and note whether or not the medicine was delivered to the patient or not, dispensed to the patient. So it actually is an investment in time, investment that will allow the nurses to actually spend more time with the patient. And that translates to improved patient care, improved patient reactions to the kind of care that they're actually receiving from our staff.
Thank you so much for sharing your insights, Dr. Beaver.
Thank you also.
Once again, that was Dr. Beaver Tameses, President and Chief Executive Officer at Asian Hospital and Medical Center. For more news, visit healthcareasiamagazine.com.